Hi, I'm Sally and I am the founder of Ocean Arts Cardiff. Music therapy is one of the types of art therapies. And the course that you do is psychodynamics, so you study a mixture of psychology and music and a tiny bit of medical studies, meaning that you can work with in a therapeutic style, but having the use of the instruments to aid communication, so it opens it up to being able to work with clients that are non-verbal or maybe don't necessarily want to talk. So it's basically a form of therapy, but you have the option of using instruments and sound as well. I was working with some children who were classed then as EBD, which is emotional behavioural disorder, and I was their mentor for a year, but I'd done a degree in music, so I got quite interested in psychology and that side of things. So someone suggested that I did a master's in music therapy. Yes, it's definitely something that is adaptable to anyone. Each of the sessions are different, and the referrals come from quite a lot of different places. So they can come from special schools, or sometimes within the NHS, or sometimes you're finding the work yourself. So basically, music therapy can be used for anyone, such as you can work with anxiety or depression, or someone that just wants to have therapy sessions for someone to talk to, or you can use the work for special needs and mental health if someone's working on, say, coordination, or experiencing different sounds, or building confidence, or helping with speech, developing, sounds through song, etc. So there's a lot of different ways you can use music therapy. Yes, yeah, definitely. I think especially in different countries, there's slightly different styles in, say, like America and Canada, and here there's some music therapists that use more sort of recorded music or technology, or more song or creative groups. A lot of the music therapy in this country is based around improvisation and techniques that sort of stem from mirroring and supporting the sounds that your clients are made through the use of improvisation and improvised sounds. I think that try and make the sessions as welcoming and comfortable as possible. We've created a space that is especially for music therapy, so it's somewhere that's had a bit of thought into the build, and I try to provide sessions that are individual for each client, so try and make them as adaptable and as unique as possible for the needs of the client. There is no typical. I think that's very much dependent on the client and who I'm working with. So if someone is, say, in a wheelchair and totally non-verbal, their sessions are going to be very different to, say, a student that's on a music therapy course coming to me for music therapy sessions. So the typical session is dependent on if the client has any goals, but usually revolves around a mixture of some talking and some playing and some sounds. But what happens within that is very individual to whoever's having the therapy sessions.